Hello everyone and welcome to our veterinary studio session, Veterinary Advice for Life, all things puppies, kittens and neutering. Instead of a traditional webinar approach, we are keen to try a new way to provide education virtually and welcome you to Royal Canin's first ever expert panel discussion for veterinary professionals. The panel discussion today will be focused on a pet's start to life, leveraging experts in reproduction, behaviour and nutrition to help elevate the important advice we provide for puppies and kittens in those first few consultations. As all of you tuning in will know, a large part of the work we do as veterinarians and veterinary nurses is supporting pet owners as they embark on the journey with a new puppy or kitten. You may also be feeling like you have done more puppy and kitten consultations in recent times, and this is in fact because there are a lot more pets about. Animal Medicines Australia released a report last year summarising the impact of COVID-19 on pet populations. Since the beginning of 2020, we have seen an overall 8% increase in pet populations in Australia, which has largely been driven by dog ownership. This has been estimated to be the equivalent of approximately 1 million dogs added to Australian households. While we don't have a figure to report for New Zealand, anecdotally we've heard similar reports from veterinary practices. So puppy and kitten consultations may be taking up more time than ever before. So in today's panel, we want to really tease out those common puppy and kitten consultation questions with our key experts, using the latest of what we know in veterinary medicine to answer these as holistically as possible and provide you with practical information that will assist your conversations with pet owners at your practice on a day-to-day basis. My name is Dr. Mina Hamilton and I will be hosting the panel discussion today. I've been a veterinarian for just over a decade. Nearly 7 of those years I've spent in the veterinary team at Royal Canin, most recently in the role of leading our veterinary team across Australia and New Zealand. With me today on the expert panel, we have Dr. Xavier Schneider and Dr. Jess Beer. Dr. Xavier and I are here in the studio in Queensland, Australia, and Dr. Jess Beer is joining us from Auckland, New Zealand. I'll pass to the panellists now to introduce themselves, and we might start with you, Xavier.
Thanks. Well, I'm Dr. Xavier Schneider. I work at Queensland Veterinary Specialists. I'm a veterinarian there, and all I do is reproductive work. So I'm a theriogenologist working in all species, as well as dogs and cats.
It's fantastic to have you here, Xavier. Thank you for joining our panel today. And we might throw to you, Jess, over in Auckland.
Hi there, thank you so much for inviting me to this panel. I'm excited to learn from Xavier as well. I'm Dr. Jess Beer, I live in Auckland and I run Kiwi Vet Behaviour, which is a private behaviour consulting just for dogs and cats, none of the larger domestic animals. And I also do a lot of promotion around puppy and kitten socialization, learning. So this is an awesome topic for me to be talking about. I might get excited.
We'd love you to. We're very excited to have both of you on our panel today and looking forward to getting into all aspects of puppy and kitten consultations, as nutrition, reproduction and behaviour are all very important topics at this particular stage of life. So before we begin, I just wanted to take a moment to remind all those tuning in that Royal Canin will be sending you a follow-up email after today's event with a link to complete a post-session survey. Completing the survey and telling us in 25 words or less what you learned in the panel today will give you the chance to enter our competition to win a supply of our Royal Canin neutered diet range for your clinic to give away to pet owners. We have 7 prize packs in total to give away across Australia and New Zealand, so please submit an entry for your clinic and get involved. This follow-up email will also include any resources we reference throughout the panel so you can utilise them in your clinics on a day-to-day basis. Okay, so as mentioned, this is the first time we have ever hosted a veterinary panel. When Jess, Xavier and I actually met to discuss the content we wanted to cover, it was clear there's a lot that we could talk about when it comes to puppies and kittens. However, we wanted to keep it to aspects of veterinary medicine that are highly relevant to those tuning in from practice and provide information that would very easily allow you to transform your puppy and kitten consultations and the advice you give on a day-to-day basis. To kick us off then, I may actually throw to you, Dr. Jess, to take us one step back from when we see puppies and kittens in the clinic. Can you take us all through what we should keep in mind about new puppies or kittens when they first land in a new home?
Well, absolutely. As vets, we're often only seeing them for their first or second vaccination. And by the time that puppy or kitten arrives in their new family, they've already come with preset behaviours, maybe pre-programmed ways of coping with the world. And that starts not just from when they're born, but even earlier than that. So the genetics, the breed of the parents, how the parents were fed, what kind of comfort level they were living in as well. And then the pups are born and they're exposed to a degree of different experiences that could be positive or negative, and all of that is going to impact on how that puppy or kitten copes with life as they know it from then on. So it's important that we're aware that when we're advising owners of new puppies and kittens that there might be pre-programmed little tweaks that we might need to be aware of to either help the puppies cope better or stop some of the unwanted behaviours coming out.
Yeah, I think that's a really good perspective, Jess, to provide, and something really important for us all to keep in mind when we are seeing puppies and kittens. I've also heard about sync theory. I'm wondering if you could take us through what sync theory means and how that relates to resilience of puppies and kittens.
Yes, so resilience is a really good word to consider, and sync theory was brought together by Dr. Sarah Heath in the UK. She's an amazing veterinary behaviourist. And the theory is simple in that when you're born or when you arrive as an individual, you're preset with things that you can cope with, and that would be your sync. And the sync is going to accommodate all of the input that you get during your life, the positive things, the negative things. And obviously, if you have a small sync, maybe genetically and the experiences you had has set that sync to be quite small, you're probably going to overflow a lot faster than another puppy or kitten or human that's had all the benefits they need to have a nice big sync. Now, the theory goes into a little bit more complexity in regards to little drainage holes and overflow holes to allow some of that overwhelming emotion or experience to be tolerated. But it gives us a good idea that we don't have puppies, they're not blank slates. They are going to come with pre-limits to their resilience and their ability to cope with what we as vets and what their fur parents or their family is going to be doing with them and basically introducing them to the world. There's only so much some puppies will cope with.
Yeah, I think that's a fantastic analogy, and actually probably explains how we all feel sometimes. I think we all have a predefined sink ourselves in a limited capacity. So I think on some days my sink feels particularly small. So no, that's fantastic, Jess, and really good to have us thinking about that one step before we actually see puppies and kittens in the clinic. So we mentioned earlier that Animal Medicines Australia released a report last year to summarise the impact to pet populations in Australia since COVID-19, and we suspect a similar impact has been felt in New Zealand too. Many of you tuning in may have been feeling this at a clinic level with an increase in the number of puppy and kitten consultations and even desexing procedures, so you're perhaps dabbling in more of the questions relating to this life stage than ever before. So let's get into some common puppy and kitten consultation questions and explore some newer advice that we could consider passing on. So let's start on a topic that comes up in almost every consultation: the conflict between vaccinations and safely socialising puppies. And Jess, as our behaviour expert, I might throw to you first on this. What are your thoughts on this?
I have a lot of thoughts. It's a huge, huge topic, and one of the most common questions that I get from vets, nurses, trainers, new puppy owners, less so with kittens, obviously, but without a doubt, we do need to be emphasising the importance of socialisation before those vaccinations finish. So with the latest guidelines from WSAVA, they are recommending the last vaccine is at 16 weeks. Now with your puppies, that's pretty much at the end of that sensitive period where they're going to be open to really positive socialisation experiences. So when we're recommending that they don't go out, that they don't do anything until we've completed the course of vaccinations, we're actually doing a huge detriment towards their psyche and their behavioural requirements. So I'm really proud to be part of the recent NZVA socialisation recommendations to try and give us a way of balancing this line between protecting them from infectious disease, but also protecting them from negative emotional consequences by not being able to be socialised in a way that they need to be, confident, healthy and behaviourally sound puppies in the future. So we've got some fabulous recommendations to expose puppies to what they need to add to that resilience that we discussed before. But finding ways of giving vets and nurses advice they can hand out that protects puppies, but also gives them ability to learn more about how to cope and experience things that they need to be comfortable with. You know, strange men, strange women, kids, other dogs. We can do a lot of that without going out to a big social puppy dog park. So there are ways, and it's important we start talking about that from the very beginning that we see these puppies.
Yeah, I think that's a fantastic point, Jess, that there is a lot that we can be doing within our homes, and that getting them out and about is not necessarily the be-all and end-all when it comes to socialisation of puppies. I'm curious, have we seen any impact to puppies that have been adopted or acquired through the COVID-19 period? I've heard this term COVID puppies be thrown around. Just curious to hear what your insight is on that.
It's out there, yeah, and it's really unfortunate. I would say 50% of the cases I'm seeing now as adolescents, one of the prime comments that clients would put would, they're a COVID puppy. Oh, we got them just at the beginning of the first lockdown or the second lockdown or the third lockdown. And this is why we're having issues with them. And it's not the sole reason, but it is a contributing factor. We've lost the ability to socialise the way we would normally. And so these puppies in the really critical time of life have also missed out on it. And it's a lot harder to introduce those appropriate socialisation experiences when they're 6 or 7 months. They're older, perhaps. We're doing a lot more with them and trying to rush through and replace things we couldn't do when they were younger. So it's something that we need to be aware of, and we need to have answers for our clients when they come to us saying, well, what should I do? What can I do? And recognise puppies that aren't coping in case, unfortunately, clients might say, oh, they'll be fine. They were just a little bit nervous. But the real impact of that lack of socialisation by being shut down and not seeing the world can have lifelong effects. So we want to work hand in hand with the clients and hopefully local dog trainers who are qualified to help with these particular puppies, because there's a lot of them out there. Such a shame to see, but there's also a lot that we can do to help them.
Yeah, I think that's some great advice. Thank you, Jess. And I suppose like the cat lady in me is about to bust out, but what can we do about kittens? Because there's such a focus on puppies, and I think that's largely due to the fact that puppy preschools are here, there and everywhere, so we're very used to hearing about the importance of puppy socialisation. Do you have any tips that you can share on how we can perhaps socialise kittens in a home environment?
Absolutely. I mean, we could talk for hours on this. I could be a cat lady too. We kind of forget about kittens when they come in because we don't have that same expectation of they've got to be sociable and go outside. But there's so much advice we can give to owners to help those kittens grow into being healthy, resilient, behaviourally sound cats. And a lot of the advice comes down to environmental recommendations and letting people know what's normal for a cat, that they need to scratch, that they need to play, and therefore set these owners up to provide the kittens with everything they need to be happy. There's some great resources out there from catfriendly.com and the ISFM organisation that do videos and loads of really useful handouts about basic cat body language so we can understand what they mean, what they're saying, and also how to set their world up so that they've got a really cat-friendly environment. More cats are living indoors nowadays, so they don't have the same ability to roam, the same expansive world. So we've got to give them more in a smaller area, and it can be done. And it's actually going to really improve that human-animal bond that people have with cats once they understand them. And the cats are a lot more comfortable with living in our world. So yes, loads that we can do.
Yeah, I'm pleased to hear it. I mean, I've got 2 indoor cats myself, and I work really hard to make sure that their environments are as cat-friendly as possible. So I think it's really important that we raise this with new kitten owners. With regards to kitten kindy, what are your views on that? Should clinics be making the effort to set up kitten kindy, or what else can we do in place of that? Do you have any tips or thoughts around kitten kindy?
I have some thoughts. I love Kitten Kindy. It's so much fun to do. Very few people offer it, and I think we need to start being a bit more flexible in how we offer it. So it's not really in the same traditional course that you would do, say, with puppy preschool. And I've known clinics who would present, say, just evening information webinars if they're not allowed to actually have clients into the consult, or day sessions where you've got an hour and people bring their young kittens in. making a note about sociability, we've got a narrower window with kittens to bring them into a social situation like that. So they do need to be younger, or they're going to be a little bit more hesitant or fearful. But in those situations, in those kitten kindies, we can teach clients so much more to really understand their cat. So when I've run kitten kindies in the past, we've talked about harness training. Say you have an indoor cat, you want to give them some outside experience. Basic handling, even as simple as, hey, do you know how their claws retract? Do you know why they would be scratching? Do you know how to trim their nails? And some really fun things like teaching cats to sit, high five. You can do a lot of training with a cat, and it's really exciting to see families, kids especially, get really motivated about interacting with their new kitten. And probably one of the best things I like to teach is how to give a tablet to your cat, because I think most vets would realise that it's one of the biggest jokes and one of the biggest dramas that people complain about when they can't give their cat a pill. It's actually a really simple way of teaching young kittens that that's something that they should maybe enjoy, but certainly tolerate later on, because it's such an essential part of us keeping them healthy as they grow older.
So Jess, I think you've got a video that you can talk us through that actually demonstrates perhaps how we can help cats get used to taking pills. So we're just going to bring that up for you now so you can talk to it.
Yay. So I would do a lot of fostering with kittens, and part of me bringing them up to being happy to live in a new home is teaching them handling and tableting skills. So we've got my little, I believe this was the Disney litter, so there's Cinderella and a few others in there. They're very used to being handled, and all I've got is some yummy bits of food just in my hand there, tiny, tiny little bits. Wet food is easier. As part of handling, we get these kittens, they're about 6 weeks, used to the mouth being opened and just smearing a little bit of something yummy on their tongue. And look, you can see they're actually keen to interact. What they're learning is that when someone does this, they open my mouth, good things happen. And so the training itself is really easy. We don't need to be putting a tablet all the way back, but we're just teaching them that when I open your mouth, good stuff happens. And a few experiences of this when they're in that young, sociable, enthusiastic stage of life means that later on, they're going to be much more receptive to people needing to give them tablets. So really easy thing to do. Not just kittens, you can even train older cats to do this. But it's a really simple handling technique for nurses or vets to mention or discuss when they're perhaps having to give a worming tablet to the kitten the first time they come in. We don't want that to be an unpleasant experience. So we're going to advise owners that they go home and do this little training technique with them with bits of butter or cheese, or some of the yummy recovery mousse diets would be really useful as well. So I think that's about as much explanation. You can see it pretty clearly in there. There were about 4 of those kittens running around. But it's such a simple thing to do, doesn't take long to talk about it in a consult, and makes the rest of their life just so much easier.
Yeah, I think as veterinary practitioners we can all relate to that. If we can have that reassurance that the cats are going to be easy enough to pill at home and you know, not cause damage to the pet owners, then we're going to feel a lot more confident prescribing medications and knowing that the cats will actually get the medications that they need as well. So that's brilliant, Jess, and a fantastic video.
Everyone survives. Everyone survives.
Comes away unharmed as well. That's definitely the goal. And I love that, Jess. I was very skilled, 4 kittens at once. I was really impressed watching that. So well done. Xavier, we're actually going to switch to topics and maybe steer a little bit away from the behaviour side of things and start to think more about the physical examination. And some of the reproductive side of the physical examination has certainly come up a little bit more recently, particularly when we think through the benefit of a very good vulval exam. And so I'd love to throw to you, Xavier, and hear your view around what are some things that we should be looking for when we're doing a vulval exam on a young female puppy or kitten, and then what is the associated consequence around conditions like vaginitis, for example?
Sure. So I guess that the most common complaint from owners is that they get this puppy that has a small recessed vulva and we get a little bit of vaginal discharge. And we're seeing more and more of this now, I guess, with the further breeding of puppies and also the early age desexing of puppies. So when you're examining your pets for the first time in a consult, you're going to see some of these conditions. So if you look at the screen here, you might see discharge. You see the picture on the left here, you might see little droplets of discharge, or on the far right you might see a mucus stream. Now, nothing to be worried about yet. But what you do want to do is you want to examine this and probably do a cytology on this to see really what's going on. So if we look at the two pictures in the middle there, we can see that we've got cell types and we've got white cells there as well. So the cell types are parabasal cells, meaning that our bitch is not in season, but really important to know that we're not seeing masses of bacteria, and that's the most important thing. They're not got an infection, that this is a normal process of development, and we're seeing more and more of this vaginal discharge occurring. So we call this juvenile vaginitis, and juvenile vaginitis really is a natural thing for the bitch to go through, where she's turning over her vaginal epithelial cells, which we can see in that cytology in the middle there. And then we're able to clear the contents of that vaginal discharge and really be able to change the flora of the vagina. Now, if we desex these animals really early in this stage, we're going to cause that vaginitis to persist, and that's really bad. We don't want that vaginal discharge from the vagina to persist. We want it to clear through. So allowing these girls to have a heat and clear all of this discharge that we can see will allow that to go.
Okay, so antibiotics are not needed?
No, not at all. And if we look at the next slide, you can actually see if we were to scope these girls, we would not see that there's a need for antibiotics, right? So there's no pus there in the discharge. There's a little glistening mucus there that is normal, a normal discharge. If you look at the picture on the right, you'll see that it's very crenellated. We call it crenellated, but it's like a cobblestone appearance. And that cobblestone appearance is what we should see when a girl's in season. And that allows her to turn over the cells and to really cause all of that discharge to be expelled. The picture's on the left. So if we look at the top left, it's dry, barren, it's very red. This is a girl that was desexed early and the vaginitis will persist. If we look at the picture below that, on the bottom left, it's bright red. That's a true vaginitis that's very uncomfortable. Those girls we might treat with some non-steroidals or some form of pain relief. But what we really want to do is we don't want to be prescribed them antibiotics because there's no infection. Now, the picture in the middle might be a little bit hard to see, but there's a foreign body there. There's actually a piece of hair that's sitting right around the vaginal fornix there, and sometimes that's enough just to cause the discharge to occur. So sometimes scoping is really good to make sure that it's not something that's in there, but generally we don't need to use antibiotics. All we need to do is give her some time, a cycle, and then it'll clear.
Okay, yeah, that's really good advice. And is that also the same for young female cats, or is this sort of something that we see almost exclusively in dogs?
Yeah, mostly in dogs. We don't really see it in cats. I guess cats can get it. It hasn't been reported in cats, but we generally see this in dogs. Now, I should mention too that that juvenile vagina that we see in these puppies that's tucked up and small inside, as she has her heats, it'll allow it to mature and to become more florid and gain its mature state. So, a cycle or two, and then this should disappear.
Okay, that makes perfect sense. Thank you, Xavier. And I'm going to keep you around the rear end of the animal, if that's okay. And now we'll talk about male animals.
Yes.
So what about testicular descent, rather? When should we be worried that they are potentially cryptorchid?
Yeah, so I guess testicular descents is quite controversial, and part of this is still unknown. So if we look at the first slide we got here, we should probably go back and work out how testicular descent occurs. Now, it occurs in 3 stages. So the first stage is our abdominal translocation. So you can see on the picture there on the left, we've got the testicle that arises from the cord pole of the kidney, and as the abdomen enlarges, that testicle will translocate down to the transinguinal ring, right? So it's going to stretch down as it goes. Now, this occurs under the influence of IGF-3, not testosterone, interestingly. Most people think that it's a testosterone involvement that this needs to occur, but it doesn't. Then the second stage is a transinguinal migration, where we actually go through the inguinal ring and the testicle makes its way into that inguinal scrotal area, right? Now, in this stage, no testosterone and no insulin growth factor like 3. So it's just a passive movement. And then finally, we've got our inguinal scrotal migration, where under the influence of testosterone, that gubernaculum will shrink and pull that testicle into the scrotum. Now, knowing this is really important because these occur at different stages. So if we look at our next slide shows us the different times that testicular descent will occur in different animals, right? So we're worried about dogs and cats here. So if we look at the dog as an example, you can see the green part there is when we would expect to see the testicles in the scrotum. Now, if you look at that, and this is a paper that was published a few years ago, it's a great review, heavy read. You'd really need to sit down, glass of wine, have a good old read. It'll take you all night. However, you can see that there's quite a wide variability in dogs for when testicles are supposed to be descended into the scrotum. So it can occur from just after birth to up to 140% after gestation, remembering that gestation's 63 days in the dog. So it can occur for weeks and weeks and weeks later. So if you've got a puppy that you're presented with that doesn't have testicles descended, we can give it more time. We can give it 3, 4, up to 6 months time before we're worried about castrating or going to look for the abdominal testicle.
Yeah, that's really interesting because I think we're always on a mission to find both testes descended by that third puppy vaccination, which, you know, admittedly is the last time that we might potentially see that puppy for a little while. So we're always on a mission to make sure that we've discovered 2 that have descended. And what about if we do find that there's, you know, they're bilaterally cryptorchid or unilaterally cryptorchid? Do we, you know, when would we consider going in and actually doing something about that cryptorchid testes, or do we even need to at all?
It's a great question, and it's something that we're asked a lot now. So if that testicle is retained, is it an emergency and do we need to get in there and get them out straight away? And the answer is no. So yes, a retained testicle or bilaterally retained testicles will cause some form of cancer in the long term. They're still fertile, don't forget as well. However, we don't need to rush in to get them out. So we can give them time, right? We can wait to 6, 7, 8 months to see if they do descend. Sometimes we can ultrasound these animals and look in the groin, and we can see that testicle might be in that inguinal scrotal position and be able to be massaged down the inguinal ring. Remembering though that our inguinal ring will close at about that 6 months of age. So after then, our chances of getting descent's rather low. But we don't need to be racing in. We don't need to be, you know, doing exploratory surgery that quickly. We can give them some time and see if that testicle will migrate down.
Okay, interesting. And
I'm curious whether that applies to cats as well, actually. I do a lot of work with rescues, so obviously early desexing of cats and when they're cryptorchid. What would Xavier comment on our time period to wait if it's going to descend or not? Similar for dogs? Or?
Yeah, it's a great question, and there's not much research in cats, but the principles will be the same, right? So again, it's not a rush to get in there to get them out. Yes, they will become neoplastic in some form, in some stage, and it takes time. In dogs, it takes years before they become neoplastic, right? So I guess in cats, it's a little bit different, right? We're worried about cats roaming, so we do want to remove those testicles early, right? But if, you know, they're a stud cat and they're a stud tom and they're going to be used in a breeding program, we do have time where we can wait and see if they, you know, will descend.
Awesome, thanks. Sorry to interrupt there, Mina. I was bringing in the cat lady.
Yeah, no, I love it, Jess. I love it. Any kind of interruption is fantastic. Please go ahead. So thinking that we might cut back to behaviour now. So just thinking through some of the common behavioural questions that we get asked in puppy and kitten consultations. We often get asked about normal behaviours like chewing or scratching of furniture. But Jess, I'd really like to hear if there are any behaviours that you think are of note that we should be concerned about. So are there any red flags that we should be looking out for in puppy and kitten consultations?
I think that they are, and it's important that as vets and nurses we're aware of them because often they won't actually be raised by the owners. They're not going to recognise these as potentially really big issues. So I came up with 4 sort of guidelines of what you would want to be looking out for. And for example, the first one would be exaggerated fearful behaviour. Now, hopefully we recognise the signs of fear, avoidance, shaking, lip licking, yawning, shivering. And if they're doing that in response to fairly normal interactions, then I would be a little bit concerned and I would point out that maybe this puppy or kitten needs a little bit more support. The second one that we might want to be paying attention to is more puppies, I think, than kittens, but certainly they seem to have an inability to modify really aggressive play. So they're just really full on. Now, some breeds are a bit like that, but even if the playmate is showing signs of fear or trying to disengage and that first puppy or kitten won't give up, or you're seeing an animal with really significant aggression towards humans as well, so lunging or repeated bite attempts that isn't just arousal, they're the kind of puppies we need to say, hey, hold on, that's not appropriate. What can we do to help them through this? Then we might be looking at I believe we've got another picture of other forms of anxiety. So this might be just a real reluctance to interact with people or other dogs. So say they've come in for their first puppy consult and they're just terrified, they're hiding away, they're cowering, even to, benign but friendly approaches. We're going to say, well, look, this puppy's a little nervous and might need some more help to get them through it. And finally, we've got one more picture, I think. And this would be, rather than fearful and hiding, but an overly aggressive response to a normal interaction. So applying to both puppies and kittens. But if you've got a puppy kitten, 10 weeks, come in and they're growling, hissing, swiping, lip lifting because they're showing that aggression, to really simple handling, then again, this is a red flag behaviour that we need to be aware of. And I think what we need to emphasise as evidence-based scientists as well is these aren't necessarily behaviours where you just send them to a local trainer. It could well be that if they've got a combination of these behaviours and after a little bit of careful probing, it turns out the owners have noticed some issues at home, you should be seeking really qualified and evidence-based behaviourists rather than a simple trainer down the street. So hopefully we can start to recognise that maybe these puppies and kittens have some issues. They could be big issues or litter issues, but the sooner we intervene with the right help, the more likely that we'll be able to resolve it and have a happy outcome for the whole family.
So Jess, in your experience, do you find that maybe approaching some of these conversations around red flag behaviours with clients can be a bit challenging? I can imagine that in the situation, when clients come to us, these new puppies or kittens, they're such a treasured new member of the family. Can it be difficult to broach the topic that there could potentially be something behaviourally that's concerning with their puppy or kitten? And do you have some tips on how we can tactfully ask questions around this to get a gauge for how the puppy or kitten behaves at home too?
Yeah, that's a really good question because it is one of the hardest things to broach with people who are so proud of their new puppy and perhaps it's the first time they've seen these fearful behaviours in the vet clinic. And they don't want to have someone tell them that their puppy is aggressive or their kitten is naughty or aggressive. They really don't like that term. So what I tend to sort of introduce is really raising an awareness that they can recognise these more subtle signs of anxiety or fear, because once the owners can identify it, they're going to start seeing it potentially in other areas of the home. And then what we do is we bring in, well, for your puppy's well-being, for your kitten's good feeling and being happy, focusing on how the animal feels, it's hopefully going to be easier to bring them around to saying you need help for your puppy to feel better, rather than them feeling accused that they've got an aggressive dog or a pet with a problem. So I think there's a little bit of empathy and just, reading your client. We all learn the skill eventually as vets, I think, is finding a way to broach on a level that the client's willing to take our advice on board. But my focus very much with behaviour is, well, let's look at your pet is feeling this. What can we do as a team to help them, and what advice would you most benefit from at this point in time? And then hopefully touch on it again at the next vaccination. Really important that we have those follow-ups to say, hey, look, how do you feel about how Fluffy is acting at home? Have you noticed some anxieties or not? And it gives a great way of them going, oh, yes, actually, they were really scared here and here. Or, no, I've been doing what you recommended and we've got a positive reinforcement trainer, and you get to see the positive outcome. So it is a little tricky to navigate, but well worth having that discussion early on.
Yeah, thanks, Jess. I think there's some really valuable tips in there, and you can't go wrong when you keep it puppy or kitten centric, right? So I think that's a fantastic approach. So the other aspect of puppy and kitten consultations that's really important is nutrition. So nutrition is also a key component of keeping puppies and kittens healthy. And puppies and kittens have only one chance to grow up and undergo significant growth and development compared to humans in a relatively short space of time. They have very specific nutritional needs that are really different to adult pets that they require in order to meet their full growth potential. Royal Canin offers species-specific and, in the case of dogs, size-specific nutrition to support growth. And we actually are going to bring up some of those diets on the screen now for you to have a look at. But we have both puppy and kitten diets that are of a high quality and contain sufficient protein, calories to support all of their daily activities, and the correct ratios of calcium and phosphorus to support healthy growth and development. Jess and Xavier, I just thought on the nutrition note, did you have any further comments on perhaps how quality nutrition might relate to either reproduction or behaviour in puppies and kittens?
Well, I guess not on a puppy or kitten side for me, but definitely in development, gestation and breeding these girls. Very important they do get a balanced diet. Careful to watch the calcium levels and to slowly step up the increase in diet. So by the time that they do whelp, that they are on a high plane of nutrition, because obviously lactation is very demanding. So we need to make sure that they're receiving high calories, high fats, high proteins, high oils, and high carbohydrates to make sure that they're able to, produce the best quality milk they can for those puppies.
Yeah, it's hard work. Lactation is hard work, and it takes a lot of energy. And what about you, Jess? Is there anything from a behaviour perspective that you'd like to comment on with regards to nutrition?
For sure, and I would agree with Xavier that obviously that early nutrition is so important. We know that if the dam is under stress and lack of appropriate nutrition can add stress, that's going to affect those puppies or kittens in utero. And then from that moment on, absolutely the best nutrition you can possibly give them. We want those brains developing to their optimum. And again, we don't want them suffering stress from lack of requirements. It's also quite exciting the way you start introducing food as well. So it's nice that as we've got weaning formulations through to puppy mousses, biscuits, the way in which we provide food is all a really big part of enriching the lives of these puppies. So it plays a role from preconception all the way through to end. And so I would promote good nutrition.
Okay, so now let's get into some quick fire questions with the panel. So when veterinarians and veterinary nurses registered to attend this event, we asked them to submit any questions that they may want to ask us. So I thought we'd pop into a quick fire question round and actually take the opportunity to look at some of the ones that have come through. So let's kick off with the very first one. How important are treats for both puppies and kittens? And should we be limiting these in any way? And are there any treats that we would recommend over others? And we might pass to you, Jess, as our behaviour expert, to take us through all things treats. And I know you are particularly passionate about this too.
For sure, yeah. I mean, I'm the treat lady. Treats are such a valuable part of providing positive reinforcement. So making sure that these puppies and kittens have an enjoyable experience in the vet clinic or at home. And it doesn't have to be high value treats necessarily. Some dogs are so food driven, just their kibble from their normal biscuit diet, for example, would be appropriate to reward them for doing something appropriate. And therefore, if you're using it as part of their daily calorie requirement, there is no reason to be limiting them in any way whatsoever. I do a lot of puppy work. I love playing with puppies because they're so desperate to learn. And one of my favourite treats is actually the Duke treats. I'll even break them into smaller little components, so you've got multiple opportunities to reward those puppies and adult dogs. And even some of my clients who have dogs with sensitive stomachs, I find it a really valuable treat that I can use quite a lot of without causing upsets. So I would say yes, treats, don't be afraid to use them. They're a really great way of creating a good bond between the vet and the patient, and also owners and their pets.
Fantastic, Jess. And just to build on that, do you have any treats that you would recommend for cats if people are particularly motivated to use treats with their cats at home or kittens?
Well, I'm glad people will be motivated to use their treats. Cats, for sure, they're a little fussier. You'll often find that perhaps the wet foods would be more appropriate. And what you can even do is either the little pouches that dispense out or the mousses, something that's rich, flavourful, is much more likely to get that cat motivated to be involved in a training session with you.
Yeah, fantastic. And I'm glad you brought up Royal Canin and Duke. I might just mention that it is actually suitable for both puppies and for adult dogs. So it is complete and balanced to help support growth. So you can give a significant number of the Royal Canin and Duke treats and not cause any problems with unbalancing the complete and balanced puppy diet that you may already be feeding. The diet is also tapioca based and contains hydrolyzed proteins, which is why it is not going to cause any tummy upsets in those young growing puppies as well. So just great generally for adult dogs and for puppies who might have a sensitive gut.
There's another bonus as well. If you do a lot of treat training, you don't want your fingers smelling of raw meat or meat roll. And so there's Duke treats, and I know I'm raving about it, honestly, it is a personal choice, but they're really wonderful and so easy to hand out without getting all over your hands.
Yep. Okay, and our second question here is around another nutrition one actually, but I'd love to hear from the both of you, Xavier and Jess. Can high protein diets lead to aggression in puppies? Maybe Xavier, you could kick us off on this one.
It's a good question. Look, I'm not a nutritionist, but I can explain from the physiology of aggression. Well, of drive, I should say, not aggression. I'll leave aggression to Jess. But for drive's based on testosterone. Testosterone's obviously in males produced from testicles, and it's actually produced from the ovaries in a female as well. And it has nothing to do with high protein. So high protein diets won't increase testosterone levels, which people might perceive lead to, aggression. But Jess might have a different behavioural side of that.
No, thanks, Xavier. What do you think, Jess?
Yeah, well, I'm quite fascinated with Xavier's information in regards to that hormonal influence on behaviour, so I'd love to have a whole other discussion with him. But the original question, does high protein cause aggression? I would instinctively say no. I certainly have seen no evidence for it. And basically, I think quite a few years ago, they were talking about trying to modify tryptophan in the diet by feeding high protein or low protein followed by carbohydrate. There were some odd studies, but really no evidence that meant that we could manipulate behaviour in any way. So I would not be wanting my clients to worry about any issue with protein causing aggression or any other behavioural problem that I can think of.
Yeah, fantastic. And I would agree from a nutritional perspective as well. We have to ensure that puppies get enough protein. It's critical to their growth and development. So any attempts to try and reduce the protein in their diet concerns me from a growth and development perspective as well. So glad that we all agree on that one. That's great. It's also, the next question is really centred around veterinary nurses, and we know how incredibly valuable all you veterinary nurses tuning in are to our day-to-day. And the question is really centred around what could the role be of veterinary nurses in puppy and kitten advice. So I'd love to hear from you both on what you think that could look like. Sure.
Well, nurse consults are really are becoming popular, I guess, in practice now. And nurses can really add value to a client experience when they come into a clinic. So, nurses should really engage with clients, build a relationship, and really foster some of the initial questions that they have. And then by the time they come in to a veterinary consult with the veterinarian, hopefully the clients have had some experience with the nurse on, say, what options are available, as you said, for nutrition, maybe for treats that Jess talks about, enrichment experience, and maybe starting the discussion with, why we want to vaccinate our animals, so that when we actually come to the consult, we are able to then, progress to the physical exam and be able to really, hone in on the medicine and, and make sure that these puppies are, getting a good examination.
Yeah, absolutely. And what are your thoughts, Jess?
Totally agree. I mean, we're a team when it comes to nurses and vets working together, and you'll find clients will take on board information if it's delivered in a different manner or with a different turn of phrase, and making sure we're all giving them the same message, I think, is important. So the role of nurses and vets both giving out the same advice, it's going to compound and hopefully the owners go home with it lodged in their brain. So I do find nurses play a really valuable role in helping provide that information in little bits, and then introducing them to ideas that can be cemented by the veterinarian when they're actually having that physical exam. And as we've already discussed, there's a lot of information to incorporate into a puppy or kitten consult or advice session, and we can't do it all in one simple vaccine consult. So utilising those nursing skills and that nursing relationship with our clients is just invaluable. So we really should encourage them to further their own education in these particular areas, behaviour being my one, and we can just make the world better for puppies and kittens.
Yeah, I love that. And you're right, Jess, we're a veterinary team. We're not just a standalone, experts. I think we all have a role to play, for sure. And this last question in the quickfire round actually really resonated with me, and maybe it's because I'm always on a mission to try and make these puppy and kitten consultations as wonderful for the puppy and kitten as possible. But this might be a question for you, Jess, around top 3 tips for cats and dogs for fear-free puppy and kitten consultations. What are kind of the top 3 things that we can do to ensure that these puppies and kittens have a good experience when they come into a veterinary practice?
Right. I mean, top 3 is actually quite hard. I think there's so many little things that you can do. And I'm a huge advocate for people actually becoming fear-free certified, which can give you all the training that you need to tweak every aspect of the experience. Probably the first tip would be to make sure your veterinary clinic is as friendly as possible. So the environment is not going to promote fear or anxiety or stress. And then when they actually enter in, the second tip is probably, for any age actually, puppies or kittens, give them a chance to get used to where they are. We don't want to be rushing straight into picking them up, handling them, poking their mouth, sticking thermometers up. All of that's quite invasive. So start by making your environment friendly, give them a chance to get associated with it, and then you just want to pair those experiences of a veterinary exam with something good. So you don't need to be hand feeding treats. Most pets, puppies, kittens, would probably prefer if you just drop the treats down so that they can explore, find out there's yummy things, and then approach you for further interaction. And you're giving them just that little bit of control over the examination, and you're just going to find you prevent problems escalating and becoming an issue by setting them up to succeed and setting us up to succeed with a good relationship with these new patients.
I think that's fantastic. You did really well to keep it to 3 tips too, Jess. I felt like that was a tough question asking you to do that. But
Absolutely, yeah.
That was excellent. Okay, well that ends our quickfire question round. And now that takes us into the final part of this discussion panel, which is really focused around neutering and reproductive health. Okay, so now let's get into the final part of our panel discussion, which will be all focused around neutering and reproductive health. So compared to other parts of the world, Australia and New Zealand have relatively high desexing rates, with about 85% of cats and dogs desexed in Australia and about 80% in New Zealand. It's a strong part of our pet culture and commitment to responsible pet ownership, and many veterinarians and veterinary nurses are strong advocates for the procedure in cats and dogs. So it's therefore quite interesting that in recent years there's been some emerging new research relating to desexing and how that may impact the advice that we have given for so very long on this topic. So it's a big topic to broach here with the team, but Xavier, I might start with you. Can you remind us please of some of the reasons why we as veterinarians advocate for desexing?
Sure, yeah. So I guess the number one reason we desex is for population control, right? And you know, historically, that's why we've been desexing. It's drummed into us in vet schools that, you know, we don't want unwanted litters, we don't want pyometras in bitches, we don't want aggression or behavioural problems in dogs, so we want to desex. But we're starting to now think that, you know, there are other consequences if we take their gonads out too early, or really is desexing going to fix some of these problems, which I'm sure Jess will talk about in a minute, right? So the main reasons that we desex are for population control, some reproductive diseases, and then behaviour.
So speaking of behaviour, Jess, are there any circumstances where for behavioural reasons we would consider desexing?
Well, certainly I think we primarily see improvement in cats with desexing, in that they're more prone to wandering, they have the ability to do so. Spraying, that tomcat odour is not something most people want inside of their home. Unwanted pregnancies, obviously, and the behaviours associated with seeking out that ability to mate and become pregnant. We can remove all of those by actually desexing animals. So there are big pros in that respect. But we're starting to see some more research come out that are indicating young desexed animals, or more specifically animals desexed between about 6 months and 10 months, we're actually seeing an increase in unwanted behaviours in regards to fearful aggression or fear aggression towards strangers, strange dogs or strange people. So all of a sudden we have to start weighing up those pros and cons as to, do we desex them, when do we desex them, and what might the behavioural consequences be of that. It's probably a good thing to say that desexing does not stop aggression. I think that's often recommended, oh, your dog, and this is where that testosterone drive comes in that Xavier was discussing. You've got a dog that's behaving inappropriately. Desexing is very rarely the solution. It may be part of the solution, but it's certainly not going to fix all of those problems. In some respects, with the male dogs, as they approach puberty and adolescence, we start to see some of the unwanted behaviours that are driven towards that behaviour regarding seeking a mate, so mounting, spraying, roaming. And we do see some reduction in those behaviours, but again, the timing of desexing is really important to have an impact on that. Behaviours are created by a whole wealth of factors, and that impact from having gonads is only one component, and behaviour is more directly affected by other aspects like how they're raised, what kind of training techniques, and the owner-driven impacts on behaviour. So desexing alone, part of the answer, but definitely not a solution in itself. I hope that answers some of the questions that people do raise quite regularly in regards to should I desex my pet.
Yeah, I think that's really important to consider too, Jess, because we so often hear that we need to be desexing animals for behavioural reasons. So that's some really good clarification. And I think what I'm hearing from both you and Xavier is that rather than it being a yes or no response, do we desex, yes or no, there's actually a lot more to it, and it's a far more complex question and discussion with pet owners than we have previously perhaps had. And Xavier,
it's a very common question, sorry Mina,
no,
it's a very
okay.
common question that comes through to me from trainers as well, because quite often they're presented with a behavioural problem and they'll ask the trainer, should I desex my dog, will it fix the problem? And I think it's really important that we get that veterinary opinion in when we're making a permanent decision like that, because the answer to that question is it depends. And that's about as specific as we can get. So it's really wonderful to see more of this information coming from Xavier and myself and my colleagues to help people just weigh up more of the consequences of making such a decision.
Yeah, absolutely. And taking the pressure off of ourselves as veterinary professionals to give a yes or a no response, I think is really important. Giving yourself permission to actually turn it into a discussion rather than some hard advice one way or the other. Xavier, I'd love to actually just take a step back, if that's okay, and actually just consider, physiologically, what's actually happening when we desex animals?
Yeah, it's a great question, right? And if we look at the slide here, we need to start with some basic physiology, right? So the question is, when we desex an animal, what actually happens physiologically and hormonally to the body? And I teach this to vet students. I do lots of lectures on these, and most people aren't able to sort of explain exactly what happens. But essentially what happens is we lose all regulation from our pituitary. So if we look at the diagram on the left here, we can see that we've got our brain with our pituitary gland there, and then we've got our gonad, which is our ovary, right? So our ovary is sending feedback back to our brain, which is regulating hormonal production. So, for example, follicles are developing on our ovary, they grow estrogen. Estrogen sends a positive feedback to the Surge Centre, which is going to then eventually release FSH and LH as those follicles grow. And then once we get enough estrogen there, our LH level will be high enough that we're able to get, estrogen levels will be high enough that we're able to get a release of LH and cause a follicle to ovulate, right? So, first of all, the hormones that are being released, the estrogen, the inhibin, are regulating our FSH and our LH levels in our body. If we remove those gonads, we're going to start to lose some of that feedback. And if you look at the diagram on the right, the same thing happens in the male. So yes, FSH and LH is being released down to the testicle where Sertoli and Leydig cells are producing estrogen and testosterone, being converted to DHT, which is more potent testosterone in the body, and then that then is being sent back to the brain for feedback. Now, if we were to remove those gonads, we're going to have more problems. Now, if we look at the next slide, what we can see is that there's a complex steroidogenic pathway where we produce these hormones. Now, we don't need to know how all this works. We just need to be aware that these hormones are produced by lots of steps, right? So if we're removing gonads and we're removing part of the steps to produce these hormones in the body, we're not going to have them later on, right? So if we can't produce progesterone, then we can't make estrogen or testosterone or whatever we're trying to produce. And yes, our adrenal glands will produce some of these steroids, but the masses are coming from gonads. So then if we go to our next slide, this is what happens if we actually remove gonads. So you can see on the left in the normal adult, this is the entire adult, that our hypothalamus releases GnRH, and then our pituitary releases our FSH and LH, causing our ovaries or our testicles to produce some form of hormones and then release gametes, right? Now, if we were to remove them, so this is on the right, we have no negative feedback regulating that GnRH. So then we've got showers of GnRH coming down, which then means that we're going to get showers of FSH and LH. And it's those showers of FSH and LH that the research now is starting to show that it might have an effect in our body further down the track. And that's not just in dogs and cats, but in humans also, right? So it's quite a complex set of events that occur if we take our gonads out.
Yeah. And then physiologically, what could that mean for the animal? What are some of the things that we might see as a consequence of desexing?
Yeah, so we see lots of problems, right, once we remove these gonads. So if we take gonads out really early, we might see immature sexual development. And that doesn't mean sexual development in the sense that we're, you know, in breeding and litters, but what it means is immature genitalia. So as we talked about at the start, those small tucked up vulvas, or we might have small prepuce, you know, in males, which then might lead to urinary incontinence, or we might have musculoskeletal problems or cancer problems, which we'll talk about in a minute as well.
Yeah, and is it true as well that obesity, they're more at risk of becoming obese once they're
most definitely.
desexed?
And I still forget the word, but it's CKK is the hormone.
Cholecystokinin.
There you go. So cholecystokinin is produced in the stomach and in the gut of the dog, right? Well, it's actually in all animals, but if we talk about the dog and the cat, it's a hormone that's produced there with glucagon. And that hormone regulates satiety in the animal, which says that the animal's like satisfied for eating. Once we remove the gonads, there seems to be some research that shows that those hormones are regulated via our pituitary, and potentially that dysregulation of those hormones leads to an increase in food intake. Now, we know from the research that if we desex an animal, there's about a 30% increase in hunger, and then they'll start to become obese. So, and they've done studies to show that if two populations of animals, entire and desexed, are fed the same caloric intake of a diet, the same time, the same everything, that neutered animals will be 30% heavier, so to speak. So we always then say, well, we need to feed 30% less. And the research now shows that it might be an effect of the regulation of hormones from our gonads that are causing that to occur.
Mm-hmm. That is interesting, and we've certainly observed that from a nutritional perspective, that nutritional phenomenon that can occur post-desexing, and that's why Royal Canin have neutered diets specifically that are 30% reduced in calories to help pets that are desexed to maintain an ideal body weight post-desexing. And we strongly advocate for veterinary professionals to have that conversation with clients at the time of desexing or at a desexing checkup appointment, for example, because it's a great opportunity to educate pet owners around the fact that their pet's metabolism is different post-desexing and that they are far more at risk of gaining weight, and that switching to a diet like a neutered diet can actually help them to maintain an ideal body weight and prevent obesity, which, let's face it, weight loss is such an ask of pet owners and pets. And so if we can actually get in there, prevention is definitely better than cure in those situations.
It's very much something I'll raise with my adolescent dogs as well, because we're often needing to increase our value to the dog for recall training and things like that. So you've got a 10-month-old who's decided the squirrel or the rabbit's more interesting than you, so we introduce higher value treats, fattier treats, but it's often coinciding with dogs that have recently been desexed. So it is something you need to discuss to make sure owners are aware that perhaps massively increasing the treats for their training could have a consequence. So it's all tied together, for sure.
Yeah, it is, and that's a really good call out, Jess, absolutely. I'd like to go back to the consequences of desexing with you, Xavier, and maybe hone in a little bit further on some of those specifics. You mentioned the consequence on the urogenital tract. Right, yeah. Wondering if you could expand on that a little bit for us.
So the urogenital tract encompasses a number of things. So the vulva, the vagina, the prepuce in the male, and obviously the bladder as well, right? So if we focus on the female side of things, we've talked about vaginitis already. Immature vulvas are a big thing. So they did a study where they had two populations of dogs. They desexed some of them early at like 7 weeks of age, and then they desexed the others at 7 months of age. And what they found was they had a big difference in the way the genitals developed. So 7 weeks of age, premature vulvas predisposed to vaginitis. 7 months of age, vulvas that popped out and that were looking like a normal adult dog, right? So big differences, right? So and the same with prepuces, and interestingly in cats, one of the little bit I have in researching cats, if these toms were desexed early, the peen spikes regressed as well, and we know that they're testosterone driven, right? So in those two populations, they found that at 7 weeks, those male toms had no spikes on their penis, versus the 7 months of age they did. Vast differences in their genitalia. Now, also, if we go further back, so we've talked about the external genitalia and we talked about vaginitis before. If we look at the bladder is really important because we do know that if we desex animals early, that we can cause urinary incontinence. And if we look at the slide that we've got on the screen here, you can see that we've got both intact and spayed animals. And what they've done here is they've taken a section of these animals, trigo of the bladder, and they've been looking for FSH and LH receptors. So if we remove those gonads, we have that super physiologic release of GnRH, which means that we've got showers of FSH and LH. And the thought is that if we have high levels of FSH and LH in the body circulating, that we may have an effect on urinary incontinence. And if you look at the intact, the staining's darker for FSH and LH receptors. They were, I think it was mRNA for FSH and LH versus spayed animals. And you can see the difference on those histological slides with the intact being dark and the spayed animals being lighter. It means that the light one's an overexpression. So there was an overexpression and those dogs were experiencing urinary incontinence. Now there's not just, it's not as simple as just being desexed early or desexed late. There's also a weight category involved as well. So they found that heavier dogs, if they were desexed early, obviously then they experienced more risk of urinary incontinence as well versus smaller dogs. So it's a multifaceted approach in that case.
Yeah, I can imagine that the more we look, the more complicated it seems to become. Also interested to kind of hone in a little bit further on some of the musculoskeletal consequences that you touched on earlier.
So if we look at the next slide here, so lots of slides today for everyone to look at. Now, this slide actually talks about musculoskeletal as well as some cancer stuff, and we'll talk about all of that as well. But I just wanted to point you first at the scales and the legends, right? So we've got percentages of dogs on our left, and we've got different conditions down on the y-axis down on the bottom, right? So HD means hip dysplasia, CCL is acromion cruciate ligament rupture, then LSA is lymphosarcoma, HSA histiocytoma, and MCT is mast cell tumours. So if you look at each group of them, so we'll just focus first on, say, cruciates and hip dysplasia. Now, this paper was published in Golden Retrievers, and it was a study in the UK where they looked at all of the population of registered breed dogs from the Golden Retriever Society. And if we look at the graph, the dark section being the intact dogs had a lower incidence of, say, hip dysplasia than neutered early dogs. And interestingly, depending on the status, so if they were male or female, they would have a lower incidence if they were neutered late. So what we're trying to say is, in our musculoskeletal section, is that we're not saying don't desex your dog. What we're saying is, let's think about what we're looking at with the breed of dog and when should we desex this dog, right? So, if the dog's prone to, say, hip dysplasia, hip dysplasia is a multifaceted approach as well. It's not just genetic, it's also conformational, and it's also, say, the time of desexing. We want to think about what time should we be doing that. And you can see as well for cruciate disease, right? So intact dogs for the Golden Retrievers, males and females, had hardly any cruciate rupture at all, where if they were neutered early, there was a high percentage of dogs that did have a cruciate rupture. So what we want to do is we want to, again, discuss this with the owners that have Golden Retrievers and say, so this is what the research says, can we manage your dog entire for maybe a little bit longer? Now, if we then move further along to the rest of the graph with the cancers, you can see that there's an association with lymphosarcoma, a mild association with histiocytoma and mast cell tumours. Lymphosarcoma is really interesting because there's some research coming out of the US at the moment with that and with lymphoma that there's a high amount of LH receptors on those cells, and they're trying to draw a link, or they're finding that there's a link between excess release of LH, so that superphysiologic release of LH, and the disease itself. And they're finding that there's less incidence of the disease in entire dogs than in their desexed counterparts. Very interesting. Something to think about.
It absolutely is. It's
Fascinating.
Fascinating, yeah, absolutely, Jess. It's definitely food for thought, and like we sort of mentioned earlier, the more we go looking, the more complex we're finding that this topic actually is. So speaking of musculoskeletal diseases, Xavier, I wonder about chondrodystrophic breeds and introvertible disc disease. Is there any association between neutering and this particular condition?
Yeah, it's a great question too. And if we look at the next slide, you can see that they've done a study over in the UK again where they looked at dachshunds specifically. So they went through the stud book and they had an online survey for general practitioners and specialist hospitals who had treated invertebrate disc disease, and then they looked at the incidence of disc disease between unaltered dogs that were neutered before 12 months of age, and then they were neutered after 12 months of age. And interestingly, was there a link between males and females as well? And if we look at the graph here, you can see on the left, obviously, there's a risk of the mean risk of intravertebral disc herniation, and then across the y-axis, you can see that there's the dogs and bitches in the different colours there. Now, if we look at that specifically, you can see that there is a lower incidence of invertebrate disc disease in unaltered males and females, less in females again compared to their male counterparts, than if they were neutered early versus if they were neutered late, so before 12 months or after 12 months of age. And you can see again, if they were neutered early, they had a higher incidence if they were neutered, unless they were neutered late, and even lower incidence if they weren't neutered at all. Now, again, it's a multifaceted approach, right? There's, genetics, conformation, as well as, the breed disposition. And this one specifically just talks about dachshunds, but obviously there's other breeds that are, long sausage types as well, bassets as an example. But there's clearly an indication that if you leave them entire longer, that we can reduce the incidence. So pretty convincing research, if you've presented with one of these breeds of dogs, that we might want to have that discussion with the owner, because introvertible disc disease is a pretty debilitating disease in a long-bodied dog.
Absolutely, Xavier, and I think it's interesting for you to sort of demonstrate some of the impacts for us to consider when we are recommending desexing, so thank you. From a physiological perspective, I think that's fascinating. Jess, I'd love to throw to you now from a behaviour perspective. I know earlier you mentioned that there could be some benefit to desexing cats for behavioural reasons, but on the flip side, do we see any negative consequences to behaviour when we neuter pets?
Well, there's two components to that, I think, and one is that fairly recent study that did show dogs desexed early or between the ages of 7 and 10 months, I think it was, I'd have to check my numbers, did show an increase in some of those fear aggression behaviours. It's very early in the research. There's just not enough information out there for us to say yes or no regarding it, because, of course, the population's all over the world. How we've gained this knowledge, is that through owner interpretation or more qualified people? I think it's safe to say that we should be cautious in a dog that is already showing fearful behavioural issues or aggression, that we should think very seriously about what role desexing may play in doing that, and potentially avoiding that critical or sensitive period in adolescence. And as I think we've discussed previously, the issue of surgery in a young dog as well can be quite traumatic to some individuals. And if they're already vulnerable, they don't have the resilience or a big enough sink to cope with scary big surgeries, we want to think quite seriously about how we would either choose to time that desexing surgery or postpone, or how we would manage it. Lots of factors for us to think about when we're considering behaviour in that decision to desex a pet.
Yeah, great call out, Jess. And definitely some food for thought. It'll be interesting to see how that research evolves over time as well, and what we can learn further going down the track. I have to raise this because I think it's definitely one of the behaviours that I've certainly heard veterinary professionals mention as a reason to desex, and it's humping. So I just wanted to really raise humping and say, do you have any comments around it? Is it
Humping?
Yeah. Is it sexual? Is it sexual? Should we be recommending desexing?
I generally see it happening more in a dog that is aroused. Now, we use the term arousal in behaviour to just determine a dog that is in a state of excitement. Now, that excitement may be sexually driven, or it could be frustration, or it could be simply too much adrenaline, too much fun, too much excitement. And so humping or mounting either an object, another dog, a person's leg, which I think is the most inconvenient form of mounting, it is often a displacement behaviour. They've got this, and they've got to get it out. And so the only time I would really bring that in a desexing question is if it is a male approaching puberty and you're seeing other signs of sexual maturity. So more often in smaller breed dogs, at about 5 or 6 months, they might start getting a little bit argy-bargy. It's a technical term. Mounting would be one consideration. Usually if it's directed towards another dog, less so if it's directed towards people. We don't usually see that sexual drive and towards a human's leg or a chair leg or something like that, whether Xavier can weigh in on that role of the sex hormones driving that sort of behaviour. But more often than not, people complain about it in a huge range of dogs, whether they're males, females, desexed or not, and that mounting behaviour is more likely to be an arousal issue, which should be managed in different ways.
Jess, do you think that you can manage an entire dog in the sense that if you've got, say, an owner that's a stud breeder and he's got an entire dog and doesn't want to have the dog desexed, are you able to manage that dog and are you able to train that dog not to have those behaviours even though they're intact?
I think we tend to find whether it's inappropriate or not. So again, if they're actually quite happy with that behaviour, then there's no reason to stop it. If it's inconvenient, then we would train a dog to direct it in a more appropriate fashion. So you might say, okay, your favourite teddy bear, you can do that to me, but to humans and visitors in the house, that's not appropriate. And that's a very trainable thing to do. But what you may find with a male entire who's very driven, you might struggle and it's going to take a little bit more work to control because they've got that motivation that is maybe more motivating than what you're trying to train them to do otherwise. So it is trying to compete with their natural desires, potentially is a turn of phrase. It's totally possible, but you might find it would be harder than, say, a desexed male. Different motivation, different drive.
Yeah, and I think it's a good point you raised too, Jess, around, we do see humping in both male and female dogs, and we do see it when they're both desexed and undesexed. And I myself, I've got a 17-and-a-half-year-old little terrier at home, and he still humps dogs at the dog park every so often and has got that argy-bargy attitude that you mentioned earlier, and I don't think desexing has done anything to kind of decrease those behaviours, which are not always sociable.
It's just another factor in their personality. And as you've mentioned, humping, actually, I do get complaints about cats do it. So male cats will often have a favourite toy that they hump. And it's sort of like they've had a busy day, they come home, they hump for 5 or 10 minutes, and then they're quite happy. And realistically, it's not an inappropriate behaviour necessarily if it's not detrimental to them and it's not detrimental to the people in the home. But it is a normal expression of behaviour in desexed animals.
So with those considerations, both from a behavioural point of view and from a physiological point of view then, when should we be recommending desexing? And is it different between cats and dogs? And is it also different between different sizes or breeds of dogs as well?
It's an interesting question, that. And if we look at the next slide I've got here, there's not much, there's some new research that's been published by Hart. They're a group out of UC Davis in the US, and they've just published 2 papers that look at assisting the decision making for when we should desex animals. Now, this is not a hard and fast rule, and this is currently the basic literature that we've got for this, but it's a good guide to start with, right? So if we look at the first table here, this table looks at a few categories, joint diseases and cancers, but they've broken the dogs down into weight categories, right? So small, medium, standard, large and giant breeds. And then you can see that some of them, they've said we should leave them in, like they've said, should we leave intact? Should we have the choice of when we should be able to desex them? Or should we wait for certain time points to get through? And if you look at the table, you can see that the smaller breeds of dogs, we've sort of got the choice. But once we set into those standard to large breeds, we want to leave them as long as they can. Now, this information was gathered from a study where they looked at multiple university teaching hospitals in the US, gathered all the information from all of these records, looked at the different incidents of joint diseases and cancers when they presented to the hospital and then looked at when they were desexed to see if there was a correlation between the two. Now, the next table, if we look at the next table, it's a little bit more involved, and I'm sorry that it's a bit small, but it's quite long. But this one looks at individual breeds, and there's a raft of breeds there, and you can see that they again talk about leaving them intact. Is there a choice, or should we be doing them at certain time points, before 11 months and after 24 months, right? So again, your breed may be on that list or it may not be on that list, but then it's some information that we can use to educate our owners to say, okay, your breed, they recommend this. What do you think we should do? Can we manage an entire dog? These are the problems that we've got. Are we worried about any of these, these concerns? An example I use is I use mammary cancers as an example with owners. So if an owner's concerned that their dog's going to get mammary cancer and they're really, concerned because maybe they've had an experience with mammary cancer themselves or someone that they're close to, and they really don't want to go through that with their animal, well then we say let's desex straight away. We know that if we desex them straight away, they're going to have a 99.5% chance that alleviate the risk of them getting the disease, and there's such a small risk that they're going to get it. So we have that discussion, but you might want to talk to those owners. You might want to say, well, if we wait one cycle, well, we're only at 92% risk. So they might say, well, that's a risk that I can manage, for example. So we can use these papers as a guide to help have the discussion and start the discussion to see if, can we manage these dogs a little bit longer if they're worried about certain diseases. And those papers are freely available to download. They're searchable online. You can search them on PubMed and download them. And I think we're going to have them available as well for people in the packs at the end of the webinar. But I encourage you to get them, read them, use the tables, put them in an information pack if you want, because it's a good conversation starter. And then at least then you've got some evidence to say to a client, hey, you've got a giant breed dog. I'm worried about cruciate disease or hip disease. Should we maybe delay desexing that dog for a little bit longer?
Yeah, I think that makes a lot of sense. What about cats, Xavier? Is there as much research in cats?
Yeah, it's interesting. There's not much in cats. There's capital femoral physeal fractures in cats. Obviously, we know that that's desexing them earlier, they can get that disease. But really, that's about it. There's not much in cats. Interestingly, in cats with urinary incontinence, there was no link between desexing and urinary incontinence. And there's a little bit of a link with obesity, which we've talked about before. But there's not much research when it comes to cats and the effect of desexing at the moment. No doubt that it'll change and there'll be more as we go.
Yeah, there's definitely more coming through for cats just generally, I think, across the board in veterinary medicine. So it'll be interesting to see how that space evolves for cats in the future. Thank you, Xavier. That was really informative. We do tend to see a lot of pets develop fear-type behaviours after they've been in the clinic for a desexing procedure or for any surgical procedure at a young age. Jess, why does this happen? And is there anything that we can do to help them in these situations?
Well, absolutely we can help, and it is clear for a lot of patients. They'll love coming for their first vaccinations, and then they have that desex at around about 6 months of age. It's the routine time we would see them coming in. And thereafter, they're pretty nervous coming into the clinic. They're not so keen about the whole experience. And there's lots of reasons for that. Most certainly, I think we should be aware that at 6 months, you are seeing a lot of dogs approach what we would call a second sensitive period or a fear period. It's not defined, it's a little bit vague at the moment, but they're more susceptible to potentially traumatic events, causing more permanent change to their behaviour. So something like a surgical day, that's pretty big, that's pretty scary. So as vets, we want to start paying more attention to how we can reduce that stress. One of the first things is actually puppy preschools. So we build up their resilience to veterinary visits by coming and having really awesome, happy events early on in their life. And then on the day, trying to promote as much fear-free handling as we possibly can to minimise that fearful experience. And then there's the actual surgical component. So good surgical technique, really good pain relief, potentially incorporating benzodiazepines as anxiolytics on the day would be something that perhaps more vets should be considering in their pre-med. And that's going to go a long way, I think, to dampening down the effect of the trauma. And certainly it's not just desexing. If you've got animals who've had other traumatic surgeries, broken legs, anything that's required hospitalisation for periods of time, we should be paying attention to how vulnerable their brains are at that time period in that first year of life and doing whatever we can to basically reduce the long-term effects of that.
Yeah, great, Jess. And I'm sort of sitting here thinking that could be, we were talking about veterinary nurses before, that could be such a fantastic role for our veterinary nurses to step in and just ensure that all of that fear-free handling happens for those puppies and kittens so they have the best experience possible in the practice.
And it's hard, as you said, now we're in COVID puppies, we've got a really high work volume coming through, and it may seem quite difficult to make those extra little steps, but it's worth it for the lifetime of that dog so that you reduce the chance that every single veterinary visit thereafter you're going to have an aggressive dog to deal with, which will take 2 or 3 times as long anyway. So paying attention to those particularly vulnerable dogs is going to pay it out in the long run, even though it seems hard to fit into our really busy schedules at the moment.
Yeah, very important point. Very important point. This next question is a little bit left of field, but I'm keen to explore it with both of you. Maybe starting with you, Xavier. What if we want to temporarily sterilise pets? You know, what is our option now for cats and dogs?
It's a great question, actually, and it's something that we're starting to be asked more often, right? Because I guess a number of reasons. One, a breeder might not want to have that dog or bitch be able to be bred at that time, but still wants to be able to socialise them with everyone, with the rest of their animals or their pack or their herd or whatever you want to call it. But also, some owners might want to temporarily sterilise them to see if it does stop a behaviour, which I'm sure Jess will mention in a minute. Now, there's a number of ways that we used to temporarily sterilise animals, and a lot of them have problems, right? So estrogens, progesterone tablets, not good for animals. If they're entire, they're going to increase these girls of getting uterine disease, pyometras, stimulate that uterus. Not a good thing. And then there's supralorin and the deslorelin implant, which is come a long way in the male, but not in the female. So in the male, if we remember that diagram that we had at the start, that pituitary released FSH and LH via GnRH release. So when we give a deslorelin implant to a male, to both of them, we'll stop the FSH and LH coming. But what happens at the start is we get a mass release first, right? So we get a big dump of FSH and LH. Now, if it's a female, it's going to cause that ovary to develop follicles and to ovulate. So she'll have a season no matter what. But there's some side effects that can occur there. One of those side effects for girls are they can have persistent heat, they might get an ovulatory follicle or get a luteal cyst and have persistent diestral period, right, which can then increase the chances of them getting a pyometra. So that's why at the moment it's off-label in girls. So there's no way really at the moment safely that we can temporarily stop a bitch from cycling. Now, in the male dog though, the supralorin's very, very effective. So it will block GnRH at the level of the pituitary, stopping our FSH and LH release, reducing our testosterone levels. Visually, you'll see testicles go from being a normal size to the size of a pea. And once it wears off, it'll then go back to its normal size and start producing spermatogenesis again, and we'll get, sperm production. So we can use that definitely in the male to temporarily, stop reproductive behaviour and stop the gametes from working. Now, I should just go a step further from this. There's some really interesting discussions at the moment about, well then, can we desex these animals partly so we can keep some of the gonads intact, get some of the benefits, but still render them not being able to get pregnant? And there's problems with this as well, right? And most of it goes around the female. If we look at the male, the easiest thing we can do obviously is a vasectomy. It's a very easy process. We do it regularly. It's done in humans, and it's very safe, right? And it can then render them infertile, but still have all of the effects of the gonads. In the female, though, it's a little bit different, right? So in the female, there's a number of options that we can use to partially sterilise animals. We can leave one ovary in. We can tie the tubes off. We can do a hysterectomy and leave the ovaries in. Even people have talked about removing ovaries and transplanting them subcutaneously. So we're still getting some of the effects of the hormones when that neovascularization reoccurs and they get blood supply back to that gonad, and then they can remove them later. There's some big problems with all of this, right? So the first problem is that a pyometra occurs under the high influence of progesterone. So if you leave an ovary in, you are going to have a high influence of progesterone. If there's any uterine tissue left, any at all, there's a chance that it'll stimulate, get an infection and get a pyometra, which most people will call a stump pyometra, right? Now, if she's got her ovaries gone, you can't get that disease. It can't happen at all. So that's the first thing. So if you decide to leave an ovary in or both ovaries in and take out the uterus, well, then you want to make sure that you've got the whole uterus out. Now, the second one, which is probably the worst one and the one that I worry about the most, is if you leave an ovary in and remove the uterus, so do a hysterectomy, you have essentially removed part of the tubular tract that normally, physiologically, if a dog was to tie with, would be able to handle sperm and on that prostatic fluid entering the reproductive system. So we've just had floods here in Brisbane. Let's think of it like the flood, right? You get a flood that goes into the vaginal tract, but it stops at the end where you've tied it off. And there's only one place that's going to go, and it's through the weakest point, which is where you've your transection in the scar, and it's going to go into the abdomen. And then once we get sperm and prostatic fluid into the abdomen, it's a life-threatening event. We'll get a sperm peritonitis and that animal can die. So you need to be very, very, very careful that if you're leaving ovaries in and then the owners are taking the dog to the dog park, that there's a real risk that they might be cycling and then the bitch will tie with a dog. And it might be that your little chihuahua ties with a Jack Russell, but it's big enough that the two of them can cause a sperm peritonitis, or even perforate the vaginal wall because there's not enough room for distension once the mating copulatory process occurs, and then you're going to get sperm into the abdomen. So it's something that we are asked a lot about, and we really recommend probably not doing those. If you are going to try and leave ovaries in and render them that they can't get pregnant, is that you can tie the tubes or tie the tips of the ovaries and transect them, so if they ovulate, there's no way that the ovulation and the sperm can actually, the ovum and the sperm can actually meet. However, you've still got to warn the owners that there's a risk of a pyometra, and they should, every 6 months once they cycle, get those dogs checked, to make sure that they don't have uterine disease. So it's something that's quite controversial at the moment, and there's no one answer unfortunately for the girl, unless we come up with a contraceptive. Interestingly, actually, I should say interestingly, there is one contraceptive that works across all mammalian species, which is a kisspeptin vaccine, and the kisspeptin vaccine is fantastic. It works at the high level again above the pituitary, right? So in that diagram I showed, you've got your pituitary releasing GnRH that then releases masses of FSH and LH, and there's a step above that actually, which is called kisspeptins, right? And the kisspeptin release actually regulates the release of the GnRH, which then releases the release of FSH and LH. Now, if we were to technically vaccinate against that and stop the release of the kisspeptin, well, we can essentially stop the release of the FSH and LH. The problem is kisspeptin vaccines work in every species and they're not species specific. So if we get them on us, well, then we're rendered infertile as well. So at the moment, we can't use them because if we're injecting a dog and we accidentally get it onto ourselves, it's a hazard.
Yeah, absolutely. That's a biological hazard for sure.
It's a big biological hazard for sure. So we don't have those ones at the moment. But watch this space. That's the next area of research. Yeah.
Yeah, that's very interesting. It'll be so interesting to see how that evolves over time. Yeah, absolutely. Jess, Xavier mentioned earlier that there could be some benefit around temporarily sterilising animals from a behavioural perspective. So I'd love to hear your view on that and if you think there's any benefit.
Yes, it's a valuable tool to have because, as we mentioned before, certainly some behaviours could be driven by the gonads, but they may not be. And so some people would be very reluctant to do a permanent surgical sterilisation when maybe, and this is only applicable to males, as Xavier's outlined, we would temporarily sterilise them and see if we resolve perhaps the inter-dog aggression issues or the roaming or the marking. And then if it is, we'd say, well, do you still like your dog when they've been chemically sterilised? Have we lost any other behaviours that you actually wanted your dog to have? And if they're quite happy with it, then yes, you've got that permanent solution. So it is really valuable. It's not used very often. I think more so in my practice, most of the adult dogs are already desexed. So it's not a common case that I would deal with, but it's definitely an option. I was thinking also, as Xavier discussed, vasectomy as another way of managing. And it's interesting in cat colony populations, they have been using that as a technique to vasectomise a male who would then continue to present with those territorial behaviours, mating with the females, keeping a lot of the other toms away, and actually allowing you to control a colony a little bit better by utilising that partial desexing, as you would call it, I suppose, to manage the behaviour of a colony. So it's quite fascinating, the options we have out there to incorporate how we deal with the hormones and how that might affect behaviour if you've desexed all the other males in that colony. So
it's interesting that's a really interesting point, because they call that sham matings. So that if you desex the male, obviously that tom's going to roam and mate all the females, but we're not going to have pregnancies, right? And then if you've got that tom fighting, that's exactly right. Going to shun off all the other males, and then we're not going to have it. So share mating is something they use. I should just touch further on this, and this is now not something that we would worry about in our practice, so to speak, right, from day to day. But other ways that they do sterilise animals, and it's good just to know this because it helps round off the discussion with clients, is that in other countries where there's an endemic population of stray animals, they've tried injecting sclerotic agents into the gonads. So for example, they'd get roaming toms or dogs and they would inject zinc into the testicle and try to fibrose the testicle. It's something that's painful and not really done, but it was easier and quicker to capture a male and then sclerose his reproductive tract, his gonad, so sclerose his epididymis with zinc so that he would still produce testosterone and still be a normal dog, but would not be able to mate other animals. But interestingly, if you didn't get that right, and they found this, that if they didn't inject it into the right spot, they'd still somehow produce some sperm, and somehow the sperm made its way out, and somehow there was still offspring. So, I mean, at the end of the day, surgical sterilisation is still, the most easiest way to make sure that we've got, a cessation of reproduction. But it's interesting that there's other ways that we can, consider doing it. And it was interesting, Jess, when you were talking about that, not often you guys use supralorine, for example, in males to assess behaviour. I do it quite a bit. We have, and it's something that's occurring a lot in Australia. I'm not sure if it happens in New Zealand, but it happens a lot in Australia, where people will get dogs on contracts where they've got a dog as a pet, they're called a guardian, and they get the dog and they're allowed to, it's a pet. Yes. But what happens is every now and again the dog gets called in to do a mating and to be used for breeding, and then the owners will complain that the behaviour is not right because they're entire. So regularly I will put supralorins in them and say, righto, we've now rendered him infertile for 6 months. You tell us if the behaviour is any different. And interestingly, as you said, what can happen, right? So it's something that we can explore further, and it just means too that we're not making a drastic decision by saying, right, your dog's going to surgery and having its testicles removed. It's like, okay, we're giving you a chance. Go and see a behaviouralist. We might desex or we might not, based on what happens, but we can remove the testosterone at the start, and you can then see what happens to the behaviour, and then you can make a decision. Is it hormonally driven, or is it behavioural driven? Yeah, it's interesting.
It's quite great when our different areas of expertise come together, because we can learn so much.
It overlaps a lot. It overlaps a lot. Yeah.
Wow, it's a big topic, and I think we actually did a fantastic job of it. So I'm just going to say that I think we did a great job of actually exploring all the different, well, I don't think we did all the facets, but I think we did a lot of the facets of around desexing and neutering. So before I close out the panel, I just wanted to check in with you both. Jess, Xavier, are there any final thoughts?
Well, I've found it really interesting, and I like every time I do something like this and get to learn from someone else. It makes me more motivated to go out and find more information, because I've decided I need to look into, is there any more recent evidence regarding desexing and behaviour after the last papers that came out a few years ago. So I suppose it's worth just saying it's an individual decision, and we just want to take on board as vets as much information, as much recent evidence to give the most appropriate advice to our clients. science. But it's okay to not have a yes and no answer, and it's perfectly acceptable for you to say, well, it depends, let's weigh up the consequences, what's the priority for you and what's medically or behaviourally necessary for your pet. And I'm sure Xavier has something to add as well.
Yeah, so I think that for me, I just want to make sure that we all get the discussion started with our owners, right? So we're not saying straight out, 6 months of age, in you go, it's time for desexing. We should really start now to have a bit of a discussion and say, okay, let's talk about your individual case. You've got a dog or a bitch or whatever that, or a tom, a queen, do we desex now? Here are for your breed or the weight of dog or whatever, here are all of the problems that potentially that can be caused from desexing. So let's have that discussion, right? Let's say, can we manage your dog, build the relationship with the client, manage the dog for 12, 18, 2 years, and then get to a point where we're saying, right, now's the time where we should get them back in and then do the desexing procedure once they've had all the benefits of the sex steroids. The research is there. I really encourage you to have a look and read it. And as I said, those 2 papers by Hart out of UC Davis, they're a good starting point. I'm not saying they're perfect, but I'm saying they're a good starting point. So you can get them, talk to owners, because they Dr. Google a lot, right? And Dr. Google absolutely kills me. So you can have a good discussion with some evidence and some science there, and then start the conversation to say, if you can't manage it, fine, let's desex now. But if you can, let's maybe try and get them a little bit older before we do.
Absolutely. Communication is just essential.
Some great concluding thoughts there from our panellists, Xavier and Jess. Thank you both so much. And thank you all for tuning in today to our veterinary expert panel focusing on veterinary advice for life. I think we can all agree there's been some fantastic discussion, and I would like to take a moment to thank our incredible panellists, Dr. Jess from Auckland and Dr. Xavier here in Queensland with us for joining us today. And for those of you tuned in, we appreciate your feedback, so please don't forget to complete the short survey we will send you by email after this event. Let us know in 25 words or less one takeaway from today's panel that you found particularly helpful, and you will go into the draw to win a neutered diet prize pack for your clinic from Royal Canin. Please also look out for some of the further resources shared in this follow-up email that include some of the resources we have referenced throughout the panel today. So we hope you enjoyed the session, and we really look forward to seeing you along to the next one. So bye for now, and thanks again.